saw the patient, I have that many, a few minutes, I gave them the paper and have a good day and that's it. So when I got in the setup of the outpatient, and this is the same also when I'm working with the USF, I tell them I need enough time with my patient. Well, 15 minutes? No. I need an hour maybe for a new patient. And a follow-up, I need maybe 30 minutes. It's like, that's too much. I'm like, yeah, but don't I want the patients to do well. Why they're coming here? What am I doing? So what I do is really holistic way of doing things. I ask questions and I tell them, you need to put these things, questions for me. Is this related to nutrition? Like, yeah. How's their economic? How's their educational background? How is their religion? How things? It has to do with the nutrition. I said, it has, of course. If you're talking to someone, you're talking to a human being. Human is influenced by their culture, by their whatever it is. They're vegetarian, there could be, they have a disease, they have economic things. Well, I'm going to advise somebody who's, barely make it from one check to the other, tell them about getting organic food and things, and this is the healthy. Come on, this is not the way to do it. So I need to know everything about the patient and how can I help patient on that. So I'm not going, so patient, when they come, do you have things for me? I'm like, no, I have to design something for you. You don't have it? I'm like, no, because one does not fit all. So what I give somebody, 1,200 calories diet, here we go. I just printed from somewhere. Good luck. And then they come and it's like, I can't lose weight. I can't do this. Half of this I don't even eat, And it applies for diabetes, all the metabolic. And what happened? All those years, I'm looking at my grandparents. They lived a healthy life. They weren't on medications. And they lived long and healthy. But we're looking at our life. We're younger. We're on medications. We don't do well. We have all those problems. Something not right. And if you examine, and you're right, you're what you eat. So I was coming to, since it's a mental health and nutrition, and again, you have to dig in and things, and there are so many research, even at the USF now, they're doing like neurotransmitters and the relation of nutrition on those, the neurotransmitters, and I'm going to come to it and how it plays a role. Do I have the first one? So this is the introduction. How we, through diet, how can we influence the stress and the anxiety in our life? Is there anybody here in the room live without stress or anxiety? I think our life is all stress, it's all anxiety. And with the sister Isra, what she said, similar. إنك كادح لربك كدحا. That is how life. Allah subhanahu wa ta'ala did not make this a heaven, but He is testing us. And He's Rahman Rahim. He's merciful. He gives us and He also tests us. So the disease or what you have is a test from Allah subhanahu wa ta'ala. If somebody have bipolar or schizophrenia or some kind of addictive and things, and especially environmental or genetic, or sometimes because of bad decision they make. All we do bad decisions. We should not punish them. Well, you did it to yourself. We have to look at it in a different way. All right? Allah Rahman Rahim. Allah forgive us. Who are we to judge each other? And it is a kind of a stigma also, and I find it also in our community and things. And, going to psychologists, going to psychiatrists is taboo. Nobody talks about these things, and they wouldn't do it. And even sometimes I go to my clients, I'm like, you would need maybe help, maybe a little bit of antidepressant, you're going to need psychologists, they will help you maybe with anorexia nervosa, and they have anxiety or somebody that, and if it is from our community, like, no, sister, I don't want to do, I came here just to tell me things. I know. But this is also, nutrition is a prevention, yes. And you can do prevention. You teach yourself, start even when you're pregnant, because that's what the brain develop. And but when you have in a state and you cannot cope, there's a stress, cortisol, the whole thing, your brain is foggy, your anxiety, you're not making a decision, you do need. So what I see in my practice, people already went to psychiatrists, they're already on the medication, and then they come and like, okay, some of them is it, they come and they say, can we also use maybe nutrition, maybe supplements you can give us, help us. Some of them leave it all together because it did not help us. Well, it will help you. You just have to go to the right people, and they will help you. You know, it just like, for example, I deal with adult nutrition. There are people, with TPN. There are people with a kidney. There are psychologists deal with trauma. Psychologists deal with family. Sister, she has, mashallah, all that. I'm very proud of you to have somebody like that in the community. Or just like for not any physician, you can go PCP and say, I have this, and he can give you and do a trial on this. You have to go psychiatrist, for example, or if you need sometimes neurologist. So how the food is so that's what I meant by many patients go find conventional treatment to be insufficiency, and then they try to I have sometimes patients have the whole bag bringing. He says, I said, what is this? He said, well, I brought you all my supplements I'm taking. I went to the store in Brandon for the vitamin shop, and they told me, you need this, you need that, you need this. So I'm feeling better, and I'm looking this, and I'm like, oh my God, I think they have overdose of the supplements, of the vitamins, because you see this, and you see this, and you see that. And think, how much you spend on this? Well, man, I spend about $250, $300, sometimes $400 a month on those supplements. How long you been doing it? Well, I'm doing it 2 years or so. Oh, okay. Is it bad? They're looking at me. Is it bad? And I'm like, okay, let's put this on the side. Let's go over this. And I'm going to be happy to go over each of them, okay? Just don't panic. Let's do what we need to do. So that's what I am saying. Sometimes they go and turn themselves and then self-medicate themselves or use a substitute. So, I need to get into that age. I need glasses now. Healthy diet, it plays a significant role in managing stress and anxiety. Certain foods or certain dietary pattern does influence our some chemicals that it is produced in our body and either make it good or bad. So let's see what are those. How are those chemical plays important role in our way we behave, way we think, decision making. So I am coming right away to what they call it neurotransmitters. So neurotransmitters are like chemicals that is produced, and it makes like a connection between neurons with each other, and they communicate. So why sometimes you're sad, why sometimes you're euphoria, and it comes to the basic things, which is the GABA, the dopamine, and the serotonin. So let's come. I'm going to make it simple, but if you think this is a little bit boring, tell me, it's okay. Because it goes deep and deep and deep and deep into that. And if you have a question, raise your hand. Interrupt me, that's fine. We have, for example, serotonin. Somebody tell you serotonin, what comes to your mind?
Is it happiness?
Happy, exactly. I am happy now. I had that all the kind of the food and the carbohydrate and things. So I'm happy. It's a happy thing, okay? So it's a positive thing, right? So serotonin is a thing. Where do you think this is produced? When you say neurotransmitters, it has to do with something with the behavior and the way we think. But serotonin actually, believe it or not, 90% of it is produced in the gut. So coming back to the gut is important to take care of the gut, because there is really a great communication access the gut. Well, sometimes It's true when you said, how did you figure this out? Say, it was my gut feeling. It is your gut feeling. Bernard, no, seriously, it is a gut feeling. Because if your gut healthy, you're going to think healthy. How's that? Well, the gut, we have microbes, they're good and bad, right? But we have organisms in our gut, and they're good, and they're friendly. So we keep them. And they produce chemicals, and those chemicals, they connect and communicate between the brain and the gut. It's serotonin. It's the happy neurotransmitter. So, great, that's a good news. I need more of those, right? How can I get more of those? Is this so it's good. It's made in the gut. Do I need to eat food that it has serotonin? Of course, because it's not enough. And when you go through, and later on I'm telling you, when you go anxiety and stress, your body gets depleted of serotonin. And then when serotonin, so we have a balance. Everything, subhanAllah, everything is in balance in our life. We are in balance, but everything Allah put in us is balance. If you look at your lab, for example, you go to the doctor, you say the sodium and the potassium, the chloride in the balance, phosphorus and calcium in balance. SubhanAllah, even with the neurotransmitters, you see the dopamine and the serotonin are in balance. Sometimes I'm happy, sometimes I'm sad, sometimes I can't be happy all the time. I can't be sad all the time. Then there are some underlying problems, right? So serotonin is, as I said, it's a switch, and there is, so it's quite complicated. How are the pathways? But also there are receptors in the brain, and what receptors we need to turn off and on. So why I came to the gut is important to kind of feed those microbes or those organisms in our gut area. And the way we eat actually influences our gut. And I have to tell you, half of the patients that I see, they come for one reason or another. I need to lose weight, or I need to gain weight, probably. They've been through chemotherapy or things, or I have Crohn's disease, or have this, or have a neurology things, hyperlipidemia, I have this. But half of them, they always come, by the way, I have diarrhea. I almost have diarrhea. I don't talk about it, but is this important? I'm like, yeah, you need to talk about it. Or I have a constipation. When was the last time you went to the bathroom? About a week. Like a week? Of course you should tell me those things. Thank you for sharing that with me. This is important. Something is not going right in our gut, and that's why our gut's acting that way. Okay? So when we come to, so let's see here, the serotonin. What is serotonin? When we have a stress, the stress depletes serotonin from our body. It's increase the excretion of it, and it's turn on also the cortisol, which is the stress hormone. And by the way, people when they are stressed, also certain things turn on, and they start to crave most fatty foods. It's like every time they go to lunch, they go for wings or hot dogs and things. And it's not like they are going, but this is how the pathway. It goes hand in hand. Stress affects what we eat, and what we eat, and then there's a vicious circle. Now, serotonin also affects the sleep. Okay, so we have its mood regulations. And there are some studies they found that, for example, people who have anxiety, depression, especially they focus on that postpartum depression, OCD, and again, it's not the cause, because again, there are so many studies there, but we need more studies, we need more funding for those things. They found the level of certain transmitters is lower there. And then also with that, for the precursor for those transmitters is nutrients in our diet. I'm going to go back and forth so I can focus. It actually goes one after the other, but because I'm getting interested in the subject myself, so I am going, for example, zinc. All right, you hear the zinc is an important element and it's a mineral, essential mineral in our diet. And zinc, actually, mainly we find it in oysters. Is mainly we find it. It's also in plants, but it's also in the animal in abundance. In animal sources like the chicken, the beef, the lamb, the oysters, the fish, we have the zinc. So anybody here vegetarian? So okay. So they don't have to worry about that. And even though we have it in plant, it found out their absorption. So you have to think about, because people think, say, I have a deficiency, I have supplements. No. God, Allah creates those elements in our diet in such a beautiful, in the biochemistry and how it's compounded. It's only way when it is compounded this in certain pH and things, it will be absorbed. So you have to understand there's absorption and utilization of those nutrients. As I said, for example, zinc, I said how it plays a role in anxiety, depression, postpartum, and they found out also depression, but not in the maniac state. There's a depression, the first state, it helps, but not the second one. And also regulate the stress hormone, which is the cortisol. But when we have stress, it depletes the zinc. And if we have deplete the zinc, what did we say? The zinc, what does the zinc does? Helps in anxiety and things because of the serotonin. Okay? And also, zinc, we have to look at the absorption. Why didn't I say mainly is better in the animal, not the plant? Because there are certain things like the phytate in the plant prevent the absorption of zinc. Casein, a protein, decrease the absorption of the zinc. Subhanallah. Iron, decrease the absorption of the zinc. And I am thinking, it's like, wow. So all those things, and people, and we tell them take this and they don't feel, you know what? And and as I said, I look at things in different things, different cultures, and you know what? I can learn. SubhanAllah, Islam and Deen teach us everything in Quran. But it does not prevent me sometimes to learn wisdom from different cultures or religions. It's okay. I learn things that give me wisdom to help myself, to help my family, and to help my community and people as well. I'll do it and I learn. Maybe there's some kind of things. I looked at the At-Tibb al-Nabawi. So this is from the Sunnah Rasul sallallahu alaihi wasallam, what he has to do. So Rasul sallallahu alaihi wasallam did not eat meat with leban, yogurt. And do we do it? It's Sunnah, right? You don't eat fish with dairy. Don't eat meat with... My grandmother taught us that, oh, okay. Bibi, I can't, no, don't eat it. Don't eat it. Why? Because we can't eat it. It's haram? No, it's not haram, but it's better not. Rasulullah did not do it. And when they found out, casein in the protein of the dairy, actually, it competes with the zinc for absorption. So zinc does not get absorbed. So what that tell us? It's not only we have to look, that's why it's holistic thing, you don't look only evidence-based. Many years ago, I was doing my postgraduate degree in United Kingdom, it was in Glasgow. And they were telling, and this professor was telling, about the carbohydrate and the things, and I said, how about the honey? She said, honey just as a sugar, at that time, it was a long time ago, sugar and just calories, and it's not good for you and things. I said, but maybe some cultures actually, and I'm saying about the Nabawi and things. I said, but some cultures, she said, we're talking about science. There's no evidence. Can you bring me an evidence? I'm like, no, I don't have evidence, but we have respect to cultures and maybe. And I went and I said, but excuse me, doctor, if we don't have enough research, that does not tell us it's not beneficial to us, correct? She looked this, she looked. She didn't like, I think, the answer. She said, yeah, we don't have research. I said, okay, so we cannot really say it doesn't have beneficial. We say it may. Maybe we'll have a research. And actually, to be honest with you, there is this a surgeon. He is the wealth of the surgeons. He have atlas of surgery in United Kingdom. And it happened to be my husband's friend who graduated from same medical school. And he did his research because he was interested in how to link surgery with Islam, how to bring, because he used to teach also students. And he used honey in healing. So people have surgery and sometimes they have infection. And he's a surgeon, he sees that. But he did studies and he would use honey. And actually the patient healed that. And after that, now, if I go back to her, she can say, yes, honey has effect in disease and in prevention of, of our health. So going back to the Tibb al-Nabawi, actually that was hundreds of years. Rasul Sallallahu Alaihi Wasallam, and it's not only that we follow the sunnah, have ajr, but it actually benefits us. Yeah. And more studies have, is related to this. Now, coming to other things, for example, I'm so sorry, I'm going to take a long time, but I'm going quickly on these. So, coming to magnesium. Magnesium is also very important, and it has a lot of importance in the bone and other things. But coming to the only mental health, it's increased the GABA level. It's also it's in the cofactor in the enzyme, the cofactor for secretion of melatonin and serotonin. So actually, it impact the anxiety and the stress, and it also help and aid in the sleep, affect also the sleep pattern as well. So guess what is the best time to take the magnesium? In the evening. That's correct. And sometimes the patient comes and says, I have like some spasm in my leg when I sleep, and I don't know, it just bother me. I'm like, okay, what are you taking the diet? I'm like, okay, can you try some magnesium and things? And actually they come and they feel some of the relief in there. Now magnesium, we find magnesium all kind of, also again from plant city, grains, seeds, fruits, and vegetables. And that's why it's very important when we say, for example, you need to eat from all the group, and people think, I am on ketogenic diet, I am on Mediterranean diet, I am on peanut butter diet, I am on all kind of, South Beach diet, all kind of the diet. But really, we are looking into, and people talking about Mediterranean diet. Okay, so what's Mediterranean diet? What comes to you when you say somebody Mediterranean diet? And olive oil, salads, vegetables. Okay, fish. And when you look at the Mediterranean, and if you think about Mediterranean, what is it? Is it Spain? Is it Italy? Is it Morocco? Is Egypt? Is Lebanon? All of them Mediterranean. But each of them have different food, right? They have different foods, different a little bit of pattern. But they all have one thing in common. God gave them a fertilized land, a great weather, water. So they have all those fruit trees and nuts. And so and everything is there. It's a basic thing. Now it's a little bit different. Not only that, they have a lot of that olive oil, and actually they found out that people who had olive oil, and what we did tell people, it's all a balance. We tell people fat-free. Jeffrey, do you drink skim milk? Tell me.
No, I
Doctor?
drink 2% actually.
How about you? Anybody drinks skim milk? Okay, I can understand. People have hyperlipidemia, their cholesterol is high and things. We try to decrease the fat, and we look also into the fat. But we are going to the too much extreme. That is like, and I'm like, no, fat is good for you, and especially good fat. And what do you mean good fat? Well, polyunsaturated is bad. No, polyunsaturated is also good. You find polysaturated in sesame oil. You have the omega. They are good, but maybe from the vegetables. Now it's an economic thing, by the way. For many years, what did we say? Canola oil is equal olive oil, but it's cheaper. So what happened? Everybody bought canola oil. But guess what? It's not necessarily good for you. It just because in Canada, they have all those farms producing canola oil, and they said canola oil just as good as olive oil. But there's not much fact into that. So you see people drawn into buying the canola. There's nothing like an olive oil, extra virgin and things, but also other oils, polyunsaturated oil. Avocado has polyunsaturated, it's a good fat. It's polyunsaturated, yes, but it's a good fat. Omega-3 fatty acids that we find in the fish and the seafood is anti-inflammatory. And why is it important for the mental health? Because, our body is made of, organs are made of millions of cells, right? And we took in this biology classes, it's a cell, and then you have nucleus, and there's a cell wall, right? So the cell wall is made of phospholipids, right? Phospholipids. Okay, phospholipids has some fat in it. But when we are under stress, what happened? Something called oxidative stress. And for all diseases and all conditions, it all starts with inflammation. Everything that we have, it starts with inflammation. Slowly, cancer, everything starts with inflammation, and that's how it gets. It's like really inflammation, destruction of. So the oxidative stress is those scavengers, and then they break down the cell walls of the cells. So we have a living cell, there's a mitochondria, and it produces the energy and the livelihood, everything goes in the cell. So it breaks, it dies. And the next, and the next, and the next, before you know it, is the whole tissue. So that is what is inflammation. That's why we get diseases. And that's all? Oh, sorry. MashaAllah. Okay, I'm good. So what I'm trying to say is anti-inflammatory. You need to eat a balance of the seafood. You need to eat meat. Now, they told me that meat is not good for you. Well, who said that meat is not good? You need meat. Why? Well, where are you going to get B12 from? Why? Well, B12 is important. The B vitamins is the B12, B6, and the folate are the vital creation of serotonin. Mm-hmm. And what did we say about the serotonin? Is the happy, calming thing, right? And then you have a folate, and you see where's the folate mainly is. Folate is very important, folic acid, especially for women who wants to get pregnant. Okay, and we find it especially in. What did we watch when we were kids? You're younger, but remember what we have to be stronger? Your parents told you to eat? Spinach Popeye. Yes, the Sailor Man. And actually spinach has, it's amazing the nutrients in that green thing. It has the zinc, it has the magnesium, it's a precursor for so many the neurotransmitters. Not only spinach and the leafy as well.